So thank you for joining us, the Kelty Mental Health Resource Center's webinar, Protective Factors for Student Mental Health and Wellbeing, Learnings from the YDI and Kids in COVID project. My name is Michelle Chamfrone, and I'm a program manager with the Health Promotion and Health Literacy team at BC Children's Hospital. And I would like to start by respectfully acknowledging that we are coming together today from many different traditional, ancestral, and unceded territories. BC Children's Hospital and the Kelty Mental Health Resource Center are located on the land of the Musqueam, Squamish, and Tsleil-Waututh Nations. And we are honored to be able to do our work on this land, supporting children, youth, and families. And we are committed to meaningful reconciliation, decolonization, and relationship building. So just a bit of background about our health promotion and health literacy team at BC Children's Hospital. So our team works to enhance the mental health and well-being of BC's children, youth, and families. And we do this in a number of different ways, including resource development, curation and navigation, education, peer support, and professional development for a variety of different audience groups, capacity building across complex systems, including schools, and building provincial networks and partnerships. Our teams also offer a variety of free services, supports, and resources specifically for school communities. So we offer support with school mental health promotion, planning, and implementation, which I'll talk more about at the end. We offer resources and support for parents and caregivers through our Kelty Mental Health Resource Center. And we provide support for school counselors and other clinicians who are providing mental health and substance use care to students through the Compass Mental Health Program. So this webinar is being brought to you by our school mental health promotion team, which works collaboratively to support schools in promoting the mental health and well-being of their students by providing mentorship, resources, and professional learning opportunities, such as this webinar. This webinar is part of an ongoing series of webinars for BC school communities and is generously supported by our partners at the Connects for Kids Fund. So a few housekeeping items now that I think everybody is joining. So you're automatically muted and your cameras have been turned off. If you have questions for the speakers, please submit those through the Q&A function. And if you have technical questions or comments, please use the chat function. At the end of the webinar, a survey link will pop up, and we encourage you to please complete that and send us some feedback. A PDF of the slides will be available at the keltymentalhealth.ca website on the school professionals page. And this webinar is being recorded, and a link of it will be made available on the website on the same page. And just to note that the information in this webinar applies to the context of British Columbia. So now I am so honored to be able to introduce our speaker today. Dr. Hasina Samji is an assistant professor in the Faculty of Health Sciences at Simon Fraser University, a senior scientist in population mental well-being and the Population and Public Health Division at the BC Centre for Disease Control, and the director of the Capturing Health and Resilience Trajectories Chart Lab. She completed her PhD in infectious disease epidemiology at the Johns Hopkins Bloomberg School of Public Health and has expertise in design and implementation of observational cohort studies and analysis of large administrative health databases. Dr. Samji leads the Youth Development Instrument, YDI, an interdisciplinary study measuring predictors of positive youth well-being, mental health, and development in high school students in collaboration with the Human Early Learning Partnership, UBC, health and education and policy partners, and with youth themselves. She's also the co-principal investigator of the BC Children's Hospital Personal Impacts of COVID-19 Survey study to measure population-level mental health impacts of the COVID-19 pandemic, and co-principal investigator of the Kids and COVID-19 Project to develop recommendations to improve youth mental health and well-being during the pandemic recovery period. So a wealth of information and knowledge from that work, and we're so happy that you're here to share some of it with us today. Thanks, Hasina.
Thank you so much, Michelle. That was quite the bio. Thank you very much. I'm delighted to be here and really appreciate the invitation in to have this discussion with individuals today who care about school communities and how we can support young people and those communities. So, as Michelle noted, my affiliations are with SFU and BCCDC. I'm also really pleased to be affiliated with HELP and BC Children's Hospital as well. I wanted to begin by acknowledging I'm so grateful to live and work on the unceded traditional territories of the Coast Salish peoples, including the Coquitlam, Musqueam, Squamish, Stolo, and Tsleil-Waututh First Nations here in Port Moody. And I also want to acknowledge my team of students and staff who really enable all of this work to happen, and the infographics and the data analysis and the reports, all very much a team effort. So I'd like to acknowledge my team as I begin. So in our time today, I'd like to share some of the findings of the Youth Development Instrument, or the YDI, data from BC that speaks to some of the protective factors that we're so interested in, as well as the COVID in Kids project, which Michelle referenced, is a study funded by BC Children's Hospital. We're going to talk about some of those key protective factors related to mental health and well-being. And then we're also going to talk a little bit about some new directions internationally, this idea of active ingredients for supporting student mental health and well-being. We'd like to start with this slide. It begins on the top left here. It says, if we want to address mental health, we need to dig deeper. And I always really appreciate this slide by Elise Ruriani. And really what it's saying is that individual factors are really important, certainly, but there are often important contextual factors that can lead to create conditions for poorer mental health and also more positive mental health. And we really do need to both measure those, whether it's poverty or injustice and trauma, incarceration, experiences of racism, and then also address them. And that's a lot of what we try and do in our work, which is very equity focused. So why focus on young people? I think this audience, I don't need to convince you here. But we know that more than 60% of people living with mental illness have the onset of symptoms before the age of 25. There was a new systematic review done this year that noted this number. It's obviously more than half. We also know that adolescence is a developmental transition period between childhood and early adulthood. It includes navigation of new physical, hormonal, cognitive, and emotional changes, and a lot of social challenges and opportunities as well. It represents a critical time for mental illness prevention and the promotion of mental health and well-being. We have seen so many promising studies of strategies that can be implemented in this stage of development that can have benefits over the life course. So bearing this in mind, my team and I developed the Youth Development Instrument, or the YDI. It's a provincial well-being self-report questionnaire, primarily for grade 11 students across BC. It was developed in partnership with the BC CDC and the Human Early Learning Partnership, or HELP. And the YDI is funded by research dollars provided to me by groups like BC CDC and SFU, as well as our national funding partners, CIHR and SSHRC. We piloted the YDI in fall of 2020 in 2 school districts and expanded that spring to 6 school districts. The following year, we rolled out provincially to about 22 school districts, and we have about 30 school districts and I think also about 30 independent schools signed up to do the survey in this upcoming implementation period, this upcoming spring. What are the objectives of the YDI? Well, we're looking for key assets developed during adolescence that create the foundations for positive mental health and well-being trajectories. We're really keen to provide all of our partners, including education, health, clinical, and community partners, with resources and tools to understand and address youth well-being. A key feature of the YDI is that we can link to past student responses from the EDI and the MDI surveys from HELP, and then also prospectively to health services and education data to really look for factors that identify youth flourishing and noting what are the modifiable factors and when are the best periods for intervention. And then last but not least, really thinking about how the public health system interacts with the BC education system and how we can all work together to support young people, keeping in mind that resources are limited and we really do need to work together. We measure a lot of things on the YDI, and we look at 5 main dimensions, so social and emotional development, social well-being, learning environment and engagement, physical and mental well-being, including access to mental health care. And then last but not least, navigating the world really thinks about things like civic engagement and engagement of young people in their wider communities. This is a map that shows the districts that participated in the YDI earlier this year. And you can see that we really have expanded provincially with about 9,200 students participating earlier this year. Here are some of the key demographic factors of the folks who participated in the survey this year. 50% said that they have a gender identity of boy or man. 3% said non-binary and 2% in another way. 23% reported LGBTQIA plus identity. And then we'll look at some of the race ethnicity data in the next slide. Just over a quarter were born outside of Canada. 60% only spoke English at home. 27% only spoke another language at home. And about 12% were urban, 88% rural in our sample. And we use a family affluence scale. Socioeconomic status is such an important predictor of youth well-being. And we can't ask young people about their family's income, but this is a proxy that we use, the family affluence scale. So this is this info I was mentioning earlier. So we compared our YDI 2022 data from earlier this year to the 2016 census. I think the 2021 census data are being released slowly, and I think will be even more representative of the ethnic composition of young people in British Columbia. So moving now to sharing a little bit of data. How are youth doing? What did we find in our survey earlier this year, asking BC's young people how they're doing? So we asked about things like life satisfaction and positive feelings. So just over a third reported high life satisfaction, and more than 50% said that they felt good most of the time. About 18% experienced high levels of loneliness. Just over a third rated their ability to handle difficult situations as very good or excellent. And we did look at COVID-related mental health. 49% rated their mental and emotional health as poor or fair during the pandemic. About 28% felt that it was easy to talk about their feelings with others. We call this emotionality. And then I'll end with looking at screening tools we included for depression and generalized anxiety. Just over 40% met screening criteria for generalized anxiety and 40% for depression. These are higher than we'd like, of course. And really, we weren't just looking at symptoms, but also functional impacts, which is really important. Because you could say that some degree of anxiety in the face of a global pandemic is very much adaptive. But when those symptoms start spilling over into impeding young people's function, that's when we need to pay a little bit more attention. And then 86% of youth on the study said that mental health is an important issue facing youth today. So that's very much overwhelming agreement with that. One of the sections we added on the YDI this year was mental health in schools. We think this is a really actionable area for schools. We know they're really interested in implementing some of these provincial strategies, like the mental health in school strategy. So we asked young people, remember, just over 86% said that mental health is an important topic for young people. What about, do people at your school talk openly about mental health? Not as much agreement with that statement. And similarly, my school encourages students to take care of their mental health. I think interesting to learn more about why students feel this way, given that they feel that mental health is so important. What about mental health literacy and attitudes? I think this is really positive. Young people do overwhelmingly agree that they know how to help a friend who's feeling worried or nervous. and are happy to develop close friendships with someone who has a mental health issue. That's, I think, very positive. So now we're going to focus a little bit more on some of these protective factors. How do we protect young people's mental health? So we ask on the survey, we ask, what are some of the coping strategies that you use or engage in when you're faced with challenging or distressing events? And then we ask a follow-up question, which is, okay, so that you engaged in that activity, and to what degree did it actually help you? And I find this interesting because the number one activity that young people noted that they engage in is being on a personal device, but only 50% actually found it helpful. And you can compare that to something like connecting with romantic partners, where 70% found that helpful. Similarly, number 4, physical activity and exercise, again, almost 70%. And then going down here to spending time outdoors. And so what I really like about this is it's young people telling us what's helping them, and they're very much modifiable factors, things that we can incorporate more into the daily school day. One of the other things we look really closely at in the YDI survey is positive childhood experiences. We know we can't protect young people against all forms of adversity, but there's some really promising research showing that positive childhood experiences, or PCEs, can be protective and buffer experiences of adversity. And some of these are warm and supportive homes, participating in community traditions, positive relationship with peers, and positive school relationships. So we looked at this in the YDI this year and last year, and we found the PCEs most strongly related to mental well-being, were social and emotional competencies such as self-esteem, optimism, and emotional regulation, positive experiences at home, like supportive caregivers, feeling safe, feeling that sense of connection, positive school experiences, feeling safe at school and a sense of belonging, and also spending time with supportive peers. Last but not least, we know how critical good sleep is. That's definitely something we found on our survey, and that good sleep was very much associated with positive mental health and well-being. So we measured the number of PCEs as conceptualized by Bethel and her colleagues. There are a lot of different ways to conceptualize both the PCEs as well as the adverse childhood experiences, or ACEs. And the list of 7 includes things like can talk about feelings openly with family, again, participating in community traditions, and feeling supported by friends. And so this is the distribution from 0 to 7. And you can see that in our sample, just over almost 9,000 students, there were certainly a lot of young people who experienced many of the PCEs, but there's room for more. And again, many of these are modifiable. We looked at the relationship of PCEs with some of our screening tools for anxiety and depression. And if you look down the middle here, 0 to 7, those represent the PCEs. So going from no PCEs experienced all the way up to experiencing all 7. You can see that there's a dose-response relationship. So the more PCEs experienced, the lower the prevalence of anxiety, or the positive screening on this test. So to read the legend, more than 3 or more represents screening positive, and similarly 10 or more represents positive screening for depression. So right around here, and again, that same dose response relationship, more PCEs, less depression. So what about the impacts of the COVID pandemic? We're really interested in learning how the pandemic impacted youth mental health, as well as what helped. So I want to share the COVID and Kids project. This is a project co-led by Dr. Evelyn Stewart at BC Children's Hospital and myself, and funded by BC Children's. And there were a few different components of the project, including some deliberative dialogues where we brought together people from different sectors in education and public health and clinical and community partners and education, as well as youth themselves. And then we dug into some of the data sources we had available. So that represented the YDI, as well as the PIC survey that Michelle noted in my bio. And one of the key objectives for the project were to understand the impact of the pandemic on youth mental health, understand if that impact differed across subgroup populations, look really closely at protective factors primarily. And if we start with the first objective, thinking about how mental health changed over the pandemic, we see that young people rated their mental health as having declined, and that was statistically significant. What I always like to highlight is that it's an average. And so there are actually some groups that had better mental health during the pandemic, but on average, mental health declined for young people. What were some of those subgroups that were affected in our BC data that we were looking at? So we saw that there were disproportionate impacts on female populations, as well as gender and sexual minority youths. And again, thinking about some of these protective factors. So we looked in a few different broad categories. We looked at personal level factors. We looked at family level factors related to peer relationships, as well as schools. So starting with the personal protective factors, these were the things that we found were really important. So we mentioned some of these already: self-esteem and optimism, emotional regulation and sleep, but physical activity and self-care, defined however they defined it, were also important on the PIC survey. When it comes to family protective factors, supportive adults at home, positive family relationships, good communication with parents and guardians, and feeling connected to family were some of the factors that we found were associated with positive mental health. When it comes to peer factors, friendship intimacy, the degree to which you feel like you have a friend that you can confide in, supportive peers, as well as experiences of hanging out with friends, were protective during the pandemic. At the school level, feeling safe at school was really important for young people, as well as school belonging. Feeling that there was a positive school environment helped young people feel mentally well, as well as supportive teachers and school counselors. In terms of community and contextual protective factors, we found that attending support groups, spending time outdoors, participating in usual extracurricular activities, as well as youth organizations, spiritual or religious activity, as well as volunteering, were all protective for young people. So many of these protective factors are not new. We're looking at them in the BC context and during the pandemic, but they're very much in line with what's been seen in other work. But I think what's really exciting is now thinking about those active ingredients. So what can we actually do to support young people's well-being? There's been some emerging research by the Wellcome Trust in the UK. They funded more than 50 research teams across the world to review evidence on depression and anxiety prevention and treatment interventions for young people. These teams investigated what they call active ingredients, or key factors that impact the effectiveness of anxiety and depression interventions. So many of you will know there's lots of programming. We don't always know what works and for whom. So that's what some of this work is starting to do. And those reviews started in 2020 and have now started providing their results. So again, the Wellcome's work is aimed at those who work on evidence-informed programs, policies, and interventions for youth mental health. And we were pleased to see that there were many overlapping active ingredients between the YDI subdomains and COVID in kids, as well as the active ingredients found by Wellcome's researchers in all of these reviews that were undertaken. So you can see the asterisk represents overlap with the YDI. They looked at 6 different areas: behaviors and activities, active ingredients in cognitive and intentional skills area, beliefs and knowledge, human connection, brain and body functions, as well as socioeconomic factors. It was very comprehensive, really thinking holistically about young people's mental health and well-being. And what's really exciting is that they're going to now be moving from thinking about, well, what are those active ingredients, to thinking about the mechanisms for how do they actually work. And so I think all of us will stay tuned to learn a little bit more. So in terms of the YDI findings and active ingredients, fostering human connection through family, peers, school, and the community as a way to support youth mental health and well-being is a commonality. Social inclusion interventions, thinking about allyship with 2S LGBTQIA+ students may help address some of the disproportionate impacts of the pandemic on these populations. And again, we also found that promoting things like self-esteem and social and emotional competence would be effective in supporting youth mental health in our BC data as well. So I'll end with some key messages. So while, again, we're looking at averages, overall, youth mental health continued to decline. It was declining prior to the pandemic, and it continued to decline during the pandemic. We found certain groups were disproportionately affected, including females and 2S LGBTQIA+ youth. Some of the key protective factors and actions included fostering social connection, positive school environments, reducing loneliness, and promoting social and emotional learning. And we think that YDI data, and active ingredients offer a promising recipe for youth mental health interventions. And we need to do more work collaboratively and collectively to think about what are some of these collaborations that we can undertake to address some of the protective factors that we found. And I'm really pleased to share that our COVID and Kids report that many of you, I'm sure, participated in will be available early in January. So stay tuned for that. So I believe I will stop there and pause for any questions that you have for me.
Thanks so much, Hasina. It's so wonderful to see all that information presented and to help us kind of ground our work and our understanding of protective factors in just some of this most recent and kind of COVID specific evidence. So thank you for that. There are a couple questions in the Q&A right now. So I'll read those out. And then if you do have questions for Hasina, please feel free to put those in the Q&A function. So the question is, I'm curious if you plan to collaborate with the Adolescent Health Survey at all, as they have similar questions on their survey.
Yeah, absolutely. So we have the folks from the Adolescent Health Survey on our YDI Provincial Advisory. I didn't mention we also have an amazing Youth Advisory Council across the province. So we have been collaborating with folks from that group since the beginning of the YDI. And there are some key differences. So we collect identifiable information so that we can do some linkages. And then we also provide school and district level reports, hopefully arming school communities to really think about what's happening in their local context. And we know that it actually really does differ even within a district by school, how young people's mental health and well-being are. So we try and provide that local context. And I know the Adolescent Health Survey is going into the field this upcoming spring. And so we've already talked a little bit about maybe we'll be able to compare notes and see, are we finding things that are similar? Michelle, I can see the questions. Should I continue?
Yes, sure. Go ahead. And I don't know that the participants can see them, so maybe just read the question out loud.
Oh, okay. So Ash, hi Ash, is saying, can you comment on the youth whose mental health improved during the pandemic? What were some protective factors that improved for them? Well, that's a great question, because that was initially our plan with the COVID and Kids project, is to better understand who are those youth for whom mental health actually improved during the pandemic. And we found that the protective factors were actually very similar. And so I think it's a group that we need to dig into a little bit more. And Evelyn and I are working on we call it the PICS2 survey, which is qualitative. And so we have 4 quadrants for the interviews where we're looking at those who we expected to do well and did do well, those we didn't expect to do well and who didn't do well, but then those diagonal quadrants of those who we expected to do well but didn't, and those we didn't expect to do well who did. So those are some analyses that are underway right now, and I think I'll reach out and share them with you when they're ready. So Larry is asking, hopefully I'm asking these in order. So I note the huge disparity between rural and urban respondents. What are the implications around services available due to geography? So we haven't had a chance to really dig into some of our urban-rural differences. It's certainly something we want to do. We want to look at a few different subgroups and outcomes, but we do ask quite a few questions about access to mental health services. We know that about 38% of young people felt that they needed to access mental health help in the last 6 months, but didn't access that help for a variety of reasons. We do ask why. some of those disparities are going to be, like you note, Larry, larger in certain settings, like in rural settings. So please stay tuned, and we're always open to collaboration for folks who are interested in specific populations. We have a lot of data. And so when there are folks who also specialize in different areas, it works really well to partner to learn a little bit more about some of these subgroups that have been disproportionately affected. So Asifa is asking, your data seem to be predominantly taken from rural BC. Is there a reason more urban data was not obtained? I think partly we didn't have some of the larger urban school districts participate, but Vancouver School District will be participating in this upcoming year. And so there may be a little bit more balance in some of our urban rural findings, although I would have to look to see the proportion of urban rural students in BC. I don't know that offhand, maybe somebody does. And then David is asking, will results from a YDI survey be extrapolated for individual schools? So yes, so on our website, which is thechartlab.ca, district reports are available. And then we provide school level reports directly to schools. So those aren't publicly available, but schools have access to those. Dr. Klopp is asking, how do I go about enrolling our school district in the YDI? Well, that's which school district are you? Maybe you already are, I don't know. But please feel free to reach out. We're actually closing our recruitment period at the end of this week. So you are well timed if your district is not already participating, and we'd love to have you. Chris is asking, it seemed that the Surrey School District has not participated in the YDI survey. Is that possible in the future? So we have been having conversations with Surrey, and they're keen to participate next year. So Surrey, of course, is one of the largest school districts, if not the largest. So it'll be, I think, a great collaboration, and they have some interesting ideas about how to adapt the YDI to their school district. They have a great data team, so we look forward to that collaboration. Glenn is asking, can you explain a bit more about one of the first slides? We need to dig deeper. In particular, the medical model, individual, DSM, and pathologization, if I've said that correctly. So for me, I always am inspired by that work that really thinks about the contextual factors that affect young people's mental health and well-being. If someone doesn't have access to food or housing, or is experiencing racism on a daily basis, that's certainly going to impact their mental health. And so I think societally, Nelson Mandela, I'm going to paraphrase poorly, but really said that, you know, how society treats its children is what's really critical and reflects how that society is. We need to think more about how we as a society are creating supportive environments for young people. And that includes things like racism and, discrimination, poverty, other types of victimization. So again, we focus on the positives, we focus on these protective factors, but we need to ensure that we together across intersectoral partnerships are understanding the experiences young people are facing, and then also addressing these. And so I think we need to move from that sort of downstream focus. There's so much need downstream. So, you know, I do understand why there is that focus, but if we really think about how there is so much potential upstream to really address challenges as they're emerging, that we can actually delay and prevent the onset of mental illness. So that's, I think, where I'm going with that slide and why it really inspires me.
It's such an important question. Thank you. And thanks for that, Hasina. I think, so that's all. Oh, we just had one more pop into the chat. It's a bit of a long one. So I'll let Hasina read that for a moment, and then let you know we will have a bit more time at the end if there are any kind of last questions.
Absolutely. So hi, Rachel. Good to see you. Are YDI participants self-reporting urban, rural, and family affluence, or is that data pulled from linkages? And a comment, I think it's very interesting that youth were asked about the activities they find to be supportive, and also the subsequent reflection of how helpful those activities actually are. Great questions. Thank you, Rachel. So that's actually, so the family affluence is self-reported, and then the urban rural is taken from the postal code that's provided. So there's a lot of different ways to consider what is urban and rural. but we really look at that middle, that middle digit in the postal code to inform. But again, there's different ways to conceptualize rurality. Thanks for the question.
Great, thank you so much. So I think, like I said, we'll have a few more minutes for questions at the end. And I'm just going to share a bit more. I know a lot of the data that you shared is tied to school communities and the school environment and supporting kind of that kind of sense of belonging and connection in schools. And so the work that our team does is looking at how we can support that and shine a light and share resources and share the collective kind of work and progress that's happening to move this conversation forward, because we, as you said, a lot of this isn't new, or because of COVID, but it's just kind of been amplified or more attention brought to it. And so I'll just share a few of the resources that we are offering through our BC Children's Kelty Mental Health Resource Center, and acknowledging just the wisdom in the room, looking at the attendees and the wisdom around the province and schools and school communities and healthcare to make a difference and to help move forward and to activate some of those active ingredients that you talked about. So we mentioned this link before, but a lot of our resources for school professionals are housed on this page at the Kelty Center, and we provide information to people working to support mental health and well-being in the school community, including teachers, counselors, administrators, district staff, community partners, and support staff, which I'm sure many of you, that's who many of you are. I also mentioned earlier that this webinar is part of a series. And if we just go to the next slide, there it is. You can view, also on our website, you can view 2 of our previous webinars, redefining and locating culture within our SEL practice and trailblazing Indigenous pathways through social and emotional wellness, recognizing again the importance of SEL and kind of those foundational components of health and well-being that Hasina mentioned. And there will be more webinars to come, so please stay tuned. Also on our webinar, or also on our website, we've started to create what we call a School Mental Health Spotlight video series. And the idea behind this is that we really want to highlight and share the stories behind many of the great resources and tools and ideas and people in school districts and in schools across BC that are already doing incredible work to support community mental health and to support student mental health and well-being and to build those protective factors. And so there's so much inspiring work happening. We only have 5 videos so far, but we're looking to increase these. So also, if you have any ideas, feel free to reach out to contact us. In addition to webinars, we also partner with our team at the Kelty Mental Health Resource Center to develop a few different podcast episodes featuring experts from around the province and guests to help us really dig into a particular topic or an idea. So we did one on staff well-being, on promoting mental wellness in rural and remote school communities and social emotional learning. And there'll be one coming out soon related to substance use. That one's being recorded, I think tomorrow. So look for that one in January. And finally, in order to kind of help collect all of this information and share it out, a big part of what we do with the BC Children's team and the Kelty Mental Health Resource Center is collecting information and resources and sharing that out and sending it to you in a way that you can share it with your colleagues and your communities. So if you want to stay updated, to keep informed on all of these different pieces and things that are happening in the space related to mental health and supporting school communities, feel free to sign up for our newsletter. You can, I think we'll put the link in the chat, and if you select school professionals, you'll get our it's about bi-monthly, our newsletter for school communities. So I think there are a few other questions. So I'm going to hand it back to Hasina to answer a few more questions that have come through in the chat.
Michelle, so let me see if I can find them. So I think there's a question from Jennifer saying, I love that you're doing this work. Thank you very much. It is clear that creating a school environment that is safe for kids is critical. I'm curious if there has been any research into how youth view their relationships with school staff, and if there are aspects they find helpful or more supportive. What a great question. I know the MDI asks these questions really well too. We do ask about who within the school environment that young people feel that they can turn to. As you say, Jennifer, it is one of the most predictive factors related to a young person's well-being, that they have a champion, whether it's in the school setting or outside, but students spend a lot of their time in the school setting. So do they have that champion? Do they have someone that they can turn to? One of our amazing Youth Advisory Council members, Adia, speaks a lot about some of the challenges that she's experienced in her life. And she had one teacher who would reach out to her and ask her, like, how are you doing? And how pivotal that was for her. We see that in the YDI as well. There is certainly a relationship between a lot of school factors, including school safety, school belonging. And so it's thinking about that holistic, like whole schools approach to creating that environment. Of course, we know that the school staff need to be well supported too. And this is the challenge, that there's so many demands in school settings. And I think that's one of my key goals, is to think about how we can collaborate across sectors to better support school communities. So from public health, which is where I hail from as an applied public health researcher, but also thinking about the wider community around schools. And we know it takes a village. How can we include that wider community to support schools as well as the young people in schools? I hope that answers your question. And then Larry's asking a question. Is First Call still in existence, as this initiative was a systemic approach for youth mental health, with education being one of the partners? So I do think that I see First Call emails in my inbox pretty regularly. So I'm not an expert in this group, but I would say that I think they are still in existence. And I don't know if Michelle, you know any more about no excuse me. But certainly I know they're doing excellent work connecting with policymakers and creating conditions for advocacy for school communities and environments. You may know more, Larry, than we do.
Well, if there are no other questions, I'm just looking at our timing here. I think we're doing pretty well. If there are any other questions, maybe we can go to the next slide, where we'll give you our contact information if you would like to follow up, if you have any further questions, or if you have thoughts of topics or concepts or something from Hasina. Presented a ton of information, and I think we could do a whole webinar on each of those slides. So if there's anything in particular that you'd love to hear more about, for us to bring that to you, we are always open to those suggestions. So feel free to be in touch with me. And so I think if there's I don't see any other questions, and that's what we had to share with you today. So thank you so much, Hasina, for joining us. I know you're not feeling well today, but for joining us and sharing all of that wonderful information. It's great to be getting that out there, and to using that, for us to be using that as a foundation and a springboard for all of our collective work in this area.
Thanks, Michelle. Thanks so much for the invitation, and thanks to all of you for joining. It's always such a positive community and such a great discussion, and I feel really privileged to be part of it. So thank you very much.
Thank you. And thank you to the Kelty team and the team for supporting on the back end, responding to the chat and keeping us organized. And thanks to all the participants. We had over, I think, 140 people to tune in today. So thank you so much. As I mentioned, you'll be asked to complete a survey when you leave. Really encourage you to do that, to give us any feedback and ideas from the session. And I hope you all have a wonderful rest of your day. Bye.